Cranial boundary will be a dome of diaphragm. Okay, so you count ribs from caudal to rostral. So you start from the sternum at 6, you go in the middle of a 6th rib, and you go to 12. So 6 plus 6 equals 12. That's the dome of the diaphragm in both. So it goes pretty much like this. Okay? The caudal border is a pelvic inlet. So the easiest way to identify on external surfaces the pelvic inlet is to look at the tubercocci. So you can see tubercocci, you don't even need to halt it, you just see it. So you go from tubercocci to the pubic bone, oblique. That's how far goes the caudal border of the abdominal canal. Cranial caudal extent. Now let's go left-right. When we split in half, on left side we just have two things. There's bleach container, which is rumen, and you can see the spleen sitting on the rumen. So don't forget about spleen. It's not only rumen, it's a rumen and spleen. And spleen is pretty much in the area of 9th rib, in the middle of the abdomen. So this populates the left side, rumen and the spleen. That's it. And the rumen has several grooves. We have longitudinal groove, lateral longitudinal groove, and medial longitudinal groove. And we have also circular grooves, caudally, and we have cranial groove over here. So these grooves are like these impressions inside forming pillars. And these pillars subdivide rumen into several compartments, but these compartments are connected, so it's not like it's wall inside. These are just inserts, like grooves inside, forming pillars. So we have a cranial sac, dorsal sac, ventral sac, and two blind sacs, dorsal and ventral. The biggest ones are dorsal sac and ventral sac divided by longitudinal, lateral and medial. So that's the anatomy, and we have the esophagus coming into the cranium. So we have a cranial pillar, circular pillar, and longitudinal pillar inside. So can you hold this for me? So from, one more thing. So from the lateral longitudinal groove, we have superficial leaf of greater omentum. Okay, so it attaches to lateral longitudinal. Medial longitudinal, we have a deep leaf of greater omentum. Okay, and between these two leaves, we have omental bursa. So really in omental bursa we have just the ventral sac of the rumen, nothing more. So that's how it is, and these two leaves go on the floor of the abdomen and connect to descending duodenum on the right side. So my hands are mesoduodenum. So descending duodenum is hanging on mesoduodenum, and below it we have deep leaf and superficial leaf of greater omentum. So above it we have supraomental recess. So all this space is supraomental recess. So to really access GI tract, we will, and jejunum, cecum, colon, we will need to go from the right paralumbar fossa, we cut in here in the right paralumbar fossa. What nerves do we need to anesthetize? Upper half of the abdomen is innervated by dorsal branches and branches of the lateral branch. So we will have a ventral branch of the lateral branch of the dorsal branch of the spinal nerve innervating the skin over the paralumbar fossa. But we also have muscles. What muscles do we have in right paralumbar fossa? Exactly. Internal, external, and transverse abdominal muscles. What's the difference between bovine and equine? There is no internal in the paralumbar fossa in an equine. So they are just external and transverse. But we are in a bovine, 3 muscle layers innervated by medial and lateral branch of the ventral branch. So muscles, ventral branch, spine, dorsal branch. And additionally, we need to do epidural because we want to anesthetize the pelvic viscera and some of the abdominal viscera, but mostly the pelvic viscera. So when we are done with this anesthesia, we do the cut, and the first thing we see is mesoduodenum, descending duodenum, and superficial leaf of the greater omentum. We can't just go through it. We'll do a lot of damage. So we need to go behind it and stick our hands like this into supraomental recess. That's where we find all the intestines. And with replacement or transposition of abomasum, sometimes it goes inside a lot, or on this side. So you can approach it from here and push rostral or here. That's where the abomasum is. And from the lesser curvature of abomasum to liver, which is sitting here, we have lesser omentum. I'll show you on a cadaver. Same situation. So the right paralumbar fossa, remember about the leaves of omentum, descending duodenum, mesoduodenum, and you go behind the supraomental recess. When you do C-section, it's most likely from the left paralumbar fossa because it's easier to just push the rumen rostral and you will have a lot of space. I'll show you on the cadaver. Anesthesia is the same, you do it on a standing count. From the left paralumbar fossa, C-section. So don't forget about the spleen, right paralumbar fossa, left paralumbar fossa, these leaves of omentum and supraomental recess, which is this one. And that's pretty much all on standing cow. And if we will go on a prosected, I'll show you all these elements.